What's the best get the red out eye drop to make your eyes nice and white? If you're interested in finding out, keep watching. Aloha everyone, I am Dr. Rupa, ophthalmologist, and on this channel we talk about eye health, eye surgery, and my passion and topic of eye makeup health. And this kind of straddles between eye health and makeup health. It's not quite makeup, but it is to improve the appearance of your eyes. So I get a lot of questions about how to make your eyes more white. That seems to be what everybody wants to do because obviously it makes you look more well-rested. It makes your eyes just pop. What's the point of doing all this eye makeup and mascara and all of that if your eyes are red and you look completely irritated? So we're going to investigate the 3 different types of eye redness drops and see which one is the best and which ones you should be using daily or not at all. All right, let's go. So we're going to talk about the 3 main classes of get the red out eye drops. So we call them oral decongestants. They're basically decongesting the look of all that redness in your eyes, and they work by causing the blood vessels to shrink down. It's also called vasoconstriction, and depending on the type that you're using, it can either affect the blood vessels, the arteries, or it can affect the veins of the conjunctiva, which is the white of your eye. So that's what gives you redness, is when your blood vessels are really dilated, they're getting really big, and then you start to see them. So it could be either the arteries or the veins that you're seeing in the white of your eye, and it makes your eyes not look so great. So in general, there are very few side effects with any of these drops. I mean, they've been studied for decades and very, very minimal side effects to using them, which is why they're available without a prescription. You can just walk into your drugstore and get them. But there are some differences as to how often you should use them and what's going on with them. First anti-redness eye drop that was created was Visine. They got a lot of market shares there at your drugstore. It was created in the 1950s. It is an alpha-1 agonist. So without getting too much into alpha-1 and alpha-2, basically there are blood vessels in your eyes and the rest of your body. Some of them have a specific receptor called alpha-1. Some of them have another receptor called alpha-2. And that is what determines what type of effect these anti-eye redness drops cause. Visine works by constricting both the tiny little arteries and the tiny little veins, they're called arterioles and venules, in the conjunctiva, in the white of your eye, to make your eyes look more white so that they narrow it down so you don't see them as much, so they're not as prominent. So what's the problem with that? Well, when it targets those particular alpha-1 receptor blood vessels, it can actually cause 2 things. One is something called tachyphylaxis. And tachyphylaxis is just the fancy medical term for basically you start using it and you have to keep using it and you have to use even more of it to reach the same effect that you did a week ago. So you maybe initially used your Visine, it worked great, and then you keep using it. 2 weeks later, it just doesn't work as well. That's not just in your head. That's actually a documented effect called tachyphylaxis with Visine. So they know about that. The other thing that Visine causes is when you stop using it, it can make your eye redness worse. So it's even here on the bottle, right here. Overuse may cause more eye redness. And they were mandated by the FDA to put that on the box in 1988 because it actually can cause your eyes to become more red if you use it too much. So that's why eye doctors really caution against overusing Visine. So the same is true about Nafcon as well. So Nafcon came to market in 1974, but it affects both alpha-1 and alpha-2. So it still has that alpha-1 effect. So it can still cause dilation of your pupil, which Visine can as well. It can still cause that redness when you stop using it, and it can still cause that redness with repeated use. So the pupil dilation is a big deal because if you have narrow angles, and that's a type of glaucoma that's narrow angle glaucoma, not open angle glaucoma, but narrow angle glaucoma, it can make your pupils larger and throw you into an angle closure attack of glaucoma. So that's why all of these boxes here say check with your eye doctor before using, and don't overuse, because if you have this setup where you might get thrown into a narrow angle attack, like I have narrow angles, I'm never going to use these drops on that off chance that my pupils are going to get too dilated. So that's just something that you need to watch out for. There are also systemic side effects of both of these medicines. So even though it's an eye drop, some of it can get absorbed into the rest of your body. And that's where it can cause trouble urinating. It can be a problem if you have high blood pressure, because it affects the blood vessels everywhere. Those particular blood vessels aren't just present in the conjunctiva of your eye. They are in your bladder, they're in your heart. So they're all in the small vessels in your body. So that's why it can affect a lot of other things as well. I mean, that's just kind of true with any type of eye drop. People forget that it can get absorbed into the rest of your body. You can do something called punctal occlusion, where you put your eye drop in and you just press on the inner corner for 5 minutes, and it helps keep the drop from going into your nose and getting absorbed systemically, but it's not foolproof. So that's the issue with Visine and Nafcon. It's why we don't recommend using them too frequently, because, I mean, it literally says it on the box. It can make your redness worse, and it can kind of create this dependency on them because you feel like you need to continue using them to keep your eyes as white as they were before. So then, what's the newest drop? That's this guy right here, Lumify, all right? So how is Lumify any different? Basically, we talked about the alpha 1 and alpha 2. Lumify only targets the alpha 2. So it's only targeting the tiny little veins called the venules. So this is thought to be better because arteries, if you remember from like 7th grade biology class, your arteries bring oxygen to your organs and your veins move it away, right? So your venules are moving oxygen away. So it's thought to be better because if it's targeting the stuff that's moving oxygen away from your eye, it's not that big of a deal, is the thought. They looked at it in all the studies. They didn't have any incidents of allergies as well. So that's really good to know. The other thing is the venules, the tiny little veins, are more superficial than the arteries. So why does that matter? Well, in the white of your eye, if it's really red and prominent, you just think about it like layers. If your veins are up here and your arteries are down here, you're going to want to get these guys to be skinnier and not as prominent, right? Because then you won't see the redness as much. So it has a more beneficial effect on the eye whiteness. It makes your eyes a little bit brighter and a little more whiter than the Visine. And that's what they looked at it in a head-to-head study. I believe they looked at it comparing it to Nafcon. And the interesting thing about Lumify is, just like how Latisse was a glaucoma drop before, actually Lumify is basically a repackaged glaucoma drop, but in a more dilute version. So the glaucoma drop is brominidine. And when we use it to put in people's eyes to lower their eye pressure, we use it in a percentage, typically 0.2%, sometimes 0.15%. That's like Alphagan is one of the brand names of that, but brominidine is the generic name. That's the same thing that's in here. It's just in a lower percentage. So whereas the glaucoma drop is a 0.2%, this is 0.025%. So substantially less. When they looked at the glaucoma drop version of it, it can cause, when it's being put in the eyes, it can actually cause eye redness and cause irritation of your eyes at the stronger dosage. It can cause watery or runny eyes. It can cause sensitivity to light, headaches, drowsiness, and this particular type of alpha 2 antagonist, that can also affect the lungs. So it's why when I have babies that have glaucoma, which can happen, absolutely will never give the Alphagan or brominidine drop. It can cause them to not breathe properly. You don't have to worry about it with this. Again, this is but you would never give this to a baby anyway, but you got to be careful with babies. So those are the things that happen when you have it in the glaucoma drop form, which is 10 times more strong than in the Lumify. So all of these drops, you don't put them in when you're wearing contact lenses. You don't put your contacts in, you put the drop in, and then you wait at least 10 minutes. This says that you can use it 4 times a day, but I would really caution against that because we're starting to see a lot of patients that are developing that eye redness from the Lumify. Again, it's not in reported studies, but just anecdotally in some of these communities, a lot of ophthalmologists are noticing some. So I would not use this 4 times a day for months on end. It really shouldn't be like a daily ritual thing, like you do your eyeliner and you toss a drop in, which I saw in one of those Vogues. I can't remember if it was like Hilary Duff or Jessica Alba, but she was doing it every day. I wouldn't do that, just on the off chance that maybe it might cause worsening eye redness. The other thing is, with the glaucoma drop, the incidence of allergies, of lid swelling, of redness from the drop was as high as 25%. And they also noticed that tachyphylaxis, where you don't get as strong of an effect after a long period. They did not find either of those with Lumify, but just something to know that that's what they found in the stronger dosage of the drop, and you just want to be careful. So some people might have an allergic reaction to Lumify. So always, always, always just check with your eye doctor. Those are the 3 different types of eye drops that can get the red out. In moderation, you're just using it for a couple of days, you've got really red eyes for whatever reason, go ahead, it's fine. But none of them are ones I would want you to be on routinely, because I really would rather you treat the underlying problem. Why are your eyes red in the first place? Target that instead of just covering it up. And that is just going to get a much better long-term solution. But like if you got to be on camera, or you got to, do an interview or whatever, you don't want your eyes to be so red. Definitely try that. You could try any of them, but just be careful and be mindful of some of the potential side effects. All right, guys. Hope that was helpful. Thank you guys so much for watching. Please like, subscribe, do all of that, and drop in the comment below what you are interested in seeing. I am happy to produce content that you guys are interested in. All right, until next time, mahalo.